While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog. Hey guys, welcome to another episode of Boss Body Podcast. I'm Dr. Tim Jackson, your host, and I have a very special guest with us today, Dr. Ken Sharlin. Dr. Sharlin is a medical doctor. He also has a master's in public health and is certified through the Institute of Functional Medicine. He's a board certified neurologist, consultant, functional medicine provider, assistant clinical professor, researcher, author, and speaker. His medical degrees are from Emory University, the University of Virginia, and Vanderbilt University. His functional medicine certification is through the Institute for Functional Medicine. He's the author of the #1 bestseller, The Healthy Brain Toolbox, and co-author of Nourishment, the Brain Tune-Up Food Guide. Dr. Sharlin is also a major contributor to Reversal of Cognitive Decline, 100 patients that can be found in the peer-reviewed Journal of Alzheimer's and Parkinsonism. And he has been the primary investigator in several pharma-sponsored clinical trials that have helped bring new therapeutics to market. Dr. Sharlin practices general neurology and directs his functional medicine program, Brain Tune-Up, in Ozark, Missouri. Welcome, Dr. Sharlin.
Well, thank you very much for having me.
Yeah, thanks for being here. I haven't ran into another clinician or doctor who is involved in as many things as yourself. So clearly you're doing something right. And we're lucky to have someone who is trained in conventional neurology, but who's branched out and even includes movement in his practice. Can you touch on the movement as medicine piece and what brought you to include that?
You know, it's very interesting. If you look at very conservative mainstream bodies in my world, like the American Academy of Neurology, when they come out with position statements on things like Alzheimer's disease, and they ask the question, you know, besides what drugs are available, and those are very limited, although that may expand in the near future quite a bit. But they look at lifestyle factors. Even the American Academy of Neurology has been very clear that perhaps the most potent lifestyle factor that impacts cognitive functioning is exercise or movement. And on an individualized level, if we look at whether it's chronic depression and anxiety in the psychiatric world, Parkinson's disease, we can talk about Lou Gehrig's disease, multiple sclerosis. Each of these chronic disease entities, there are peer-reviewed publications that support profound benefits, some of which actually exceed the benefit of any medication available for that condition.
Absolutely. So what percentage of your practice would you say is using functional medicine tools, and what percentage the traditional allopathic neurology tools?
Well, I would like to say it's 100% of both, because I have found in my own sort of evolution as a physician, as a provider, that I went from being a conventional neurologist and really, you know, reaching that burnout stage where, you know, it's affected so many other physicians these days. And over the past several years, you know, you just kind of, your patients are getting sicker and sicker and sicker, and you sort of win the battle, lose the war, and you put them on a drug, they get a little bit better, they come back, they have side effects, or you put on another drug, their disease gets worse, you run out of drugs to treat people with, surgery is not an option. Even when I tell, when surgery is an option, it's not always necessarily the best solution. I always tell my patients, when they cut it out, it's not growing back, so be sure it needs to be cut out. So I really hit a wall. And then I found out about functional medicine, thanks to the good work of people like David Perlmutter, very inspired by his work. And so I decided I was going to kind of follow in those footsteps and got my certification through the Institute for Functional Medicine. And then, at that stage, I'm thinking, gosh, what does conventional neurology really have to offer, compared to functional medicine? But over time, what I realized is that actually the best toolbox that I can bring into the exam room with my patients is one that includes both conventional neurology and functional medicine. If we were curing all of these terrible diseases like Alzheimer's with either one of these great tools, functional medicine or conventional neurology, we sure wouldn't need anything else. But we aren't, and we have to be very transparent that truly to bring the full set of tools to the patient encounter, we should be doing both. We should not be leaving diet and lifestyle on the table. We should not be leaving a recognition that environment plays a major role in chronic disease. Think about Parkinson's disease and the various environmental toxins that contributed to Parkinson's, right?
Right.
But person who has Parkinson's disease, for example, by the time that they are diagnosed, has already lost as much as 80% of their dopamine producing nerve cells in their brain. And there's not a single supplement, not one, that they can take that is going to replace all that dopamine. So I tell those patients, and they're very enamored, there's no question that functional medicine, when you learn about it, is just like, oh my gosh, that's the most incredible thing I ever heard of. And some of my patients are actually kind of disappointed. They came all this way to see me, the functional medicine neurologist. I'm telling them to take levodopa, but that's the truth there, that we need to work with both sides, right? We need to do the functional piece, the movement, the nutrition, the sleep optimization. Stress resilience practices have always been a huge part of my practice, very impactful when it comes to not only causing chronic disease, but improving chronic disease. And then we have to recognize, is there a place for a particular treatment or a group of treatments that we would consider conventional, and consider that on an individualized basis?
Yeah, I think what you said is so important in terms of, I might lean more towards the functional side, but if something else is working better for a patient, then why would I not go with that? Instead of
Well,
just
as a physical therapist, for example, if you can't move, so if you have Parkinson's disease, which is a movement disorder, if your patients can't move, they're not going to get a whole lot out of physical therapy.
right.
So I say, if you're bedridden, if we can use a drug that at least gets you a foot on the ground, then you can do all the other things that lead to perhaps not needing that medicine in the long run. That's ideal, right? But we sometimes need to use either the drugs concomitantly, or we need to use the drugs long enough that you can at least do the things you need to do from a functional medicine perspective, so you don't need the drugs anymore.
Yeah, and that's what I found when I did orthopedics. Now I'm all virtual, but I was treating external manifestations of internal imbalances most of the time. If someone has low free T3, they're going to have trigger points in every muscle group in the body, every soft tissue in the body. And so I found I could help people a lot more without ever putting my hands on them. Let's talk for a minute about different tests and types of testing for the brain and central nervous system that you use and that you think is best to give people a window into their overall brain health. So SPECT scans, functional MRI, QEEG. Can you touch on those?
Absolutely. So first of all, I would put it into a framework that we use every day in the clinic that we call our 5 pillars framework. And we can really just focus in on the first 3 mainly. The first one is identify, and that's really a traditional diagnostic approach. If you come to me and you say, I'm 63 years old, my mother died of Alzheimer's disease, I've been noticing that I'm misplacing things. I'm getting stuck on names of people that I know. Sometimes I just can't get the right word out. I know what I want to say, right? That starts with a good history. And that's really 80% of the diagnosis right there is sit down, listen to the patient, take a good history. The next step is a physical examination. So we can't skip the fundamentals. We take a history, we do an exam. The next step for a neurologist is something called localization. And I explain that to my patients using the example of weakness, because we all know what weakness is. So if you come in with weakness, and you have to remember that this vast geography that is the nervous system starts in the brain, and it goes all the way down through your brain stem, your spinal cord, nerve roots, peripheral nerves, neuromuscular junction where the nerves and muscles come together, and then of course your muscles. And a disruption at any one of those levels could produce weakness, any one of them. But the causes, what we call in medicine the differential diagnosis, or the list of reasonable explanations for the problem, the causes might be different for different localizations. So if somebody just says weakness, you don't go, oh, well, it might be in the brain like a stroke, or it might be a muscle disease. That's not good neurology. You have to localize first, and then you think, okay, what is the reasonable explanations based on this localization? The testing then comes directly from that localization and that list of reasonable explanations. The usual tools to a neurologist, whether you're in functional medicine or not, remain valid. That is, spinal fluid exams, blood tests, occasionally urine tests. MRI is an important tool. We do take MRI a step further in that we very commonly use what is called automated 3D volumetric analysis. That's basically software that will take those images from the MRI and analyze them and calculate the volume of different regions of the brain. And there are different brands, companies that create that software. In the functional medicine world, most people have heard of NeuroQuant or NeuroReader, but that's certainly not exclusive to functional medicine. It's just been very slow to adopt technology by the general medical world, but it's very, very useful. We are extremely interested in biomarkers and genetics, where genetics can really be actionable. So testing someone's ApoE status if they're coming in with cognitive decline because a gene called ApoE4 or apoprotein epsilon 4 places a person at very high risk for the development of Alzheimer's disease. Methylation genetics, which I'm sure you've talked about a whole lot on your podcast, we can certainly look at that from a functional medicine perspective. So some genetics is helpful. The biomarkers are helpful. We're doing skin punch biopsies to diagnose what are called alpha-synucleinopathies, which is the group of diseases that includes Parkinson's, but it can also include Lewy body dementia and other conditions that broadly go under an umbrella called multiple systems atrophy. We can do spinal fluid examinations to confirm the diagnosis of Alzheimer's disease by looking at the amyloid protein and tau protein levels in the spinal fluid. So I could go on with that, but honestly, I don't use a whole lot of SPECT. You can do a form of SPECT called a DAT scan, which is a dopamine transporter scan for Parkinson's evaluations, but we're finding the skin punch biopsy just to be so much more simple, less expensive, no radiation, covered by insurance, et cetera. I do some PET scan or positron emission tomography, but primarily in the research arena where we're looking at new emerging treatments for Alzheimer's disease. And our sponsors who work with us on these treatments largely use PET, although they are interested as well in spinal fluid testing to some degree. But PET still remains sort of the gold standard in the Alzheimer's diagnosis. So
Absolutely,
that's
yeah.
kind of,
Thank you for that. One thing you said, I was going to bring up the APO epsilon 4 or 4/4 genotype. Not only are they at an increased risk for cognitive decline in Alzheimer's, but mercury toxicity, they need to be on low fat diets. And kind of a side street off of that topic is, do you use the carnivore diet in any cases?
no, I really don't. And I will say that I agree. It's been our observation that our ApoE4 carriers, whether they are heterozygous, meaning they have one copy of ApoE4, or they're homozygous and they have two copies of ApoE4, they don't tend to do well on high saturated fat diets. So we do like them to include the mono and polyunsaturated fats. Many of them are interested in ketogenic diets, and it is possible to use a ketogenic diet and base it on olive oil and not coconut oil. It's just a little more challenging. But I would say that parenthetically, that it's a tool, meaning that the ketogenic diet is not the solution for everyone. And it's important to really have that discussion with your functional medicine provider or functional nutritionist, whomever. Is this the right tool for me? So that is certainly the case. But yes, I agree. We need to look at that status and make some, use it as guidance in helping our patients.
Yeah, I brought that up because I have a colleague who got diagnosed with Huntington's, and he's on a carnivore diet. He apparently poured through the research and found several studies pointing to the carnivore diet, and he seems to be doing better. I don't know what his neurologist is telling him, but I didn't know if you had any thoughts on that.
Well, it's not, it's not, first of all, we are omnivores as humans. And if you, from the point of view of nutrients, we have macronutrients, which are, fats, proteins, and carbohydrates. And then we have micronutrients, vitamins, minerals, and then that third class, phytonutrients. And phytonutrients are very, very powerful chemicals. There are far more phytonutrients than vitamins and minerals. And these have anti-cancer properties, anti-inflammatory properties. The classic so-called Mediterranean diet and its variants, like the DASH diet and MIND diet, have been well studied. The carnivore diet has not been well studied. I would be extremely concerned about not only the lack of phytonutrients, particularly antioxidants, and the sulforaphane-rich foods, the cruciferous vegetables, plus the absence of high folate foods in the diet. If I eliminated all vegetables, I would be concerned about the influence on the microbiome, in particular, the ability to produce butyrate, among other things, and to, it's so important that we eat diversely, because that diverse diet translates into a diverse and abundant microbiome. So, if you're eating a carnivore diet, you tend to probably eat about the same thing all the time. And that will have a profound, and in my opinion, potentially quite negative effect on the microbiome. So we have to think of ourselves as ecosystems.
Yeah, absolutely. I mean, I've seen in a number of people, the people I've seen with the most imbalanced microbiomes have been long-term carnivore diet people or long-term ketogenic diet people. So if you've listened to the podcast before, you've heard me mention saccharolytic fermentation or the breakdown of carbohydrates. That's how butyrate, propionate, and acetate, 3 short-chain fatty acids, are produced in the gut. And the one that Dr. Sharlin mentioned, butyrate, it helps prevent leaky gut, feed the good bacteria, but it also upregulates something called brain-derived neurotrophic factor. Can you touch on BDNF, or brain-derived neurotrophic factor?
Well, this is a growth hormone that is found in the brain. I think it's particularly concentrated in the region called the hippocampus. We think of the temporal lobes, the side lobes of the brain, and the hippocampus, which gets its name from a seahorse, the shape of a seahorse, is located on the inside surface of the temporal lobe. I always liken it to RAM memory in the computer, right? RAM memory is sort of a short-term memory holding area. And if we didn't save that document and lose power on the computer, you've lost what was in RAM because it hasn't been saved to your hard drive, right? And so that's sort of how the hippocampus functions. But it has additional connections to a complex system we refer to as the limbic system. It's kind of our primordial brain that protects us, that's on watch all the time for things that are dangerous and things that are safe. It helps us guard against, being eaten by the saber-toothed tiger, but it also tells us that, if we encounter a group of people we feel safe with, we may find food, shelter, intimacy, reproduction opportunities, and things like that. So learning, memory, fear responses, all tend to go together, love, intimacy, all within the limbic system. And I always say that, if you step on something sharp, it hurts, but the goal is to also remember that whatever you stepped on, hey, that's sharp and it hurts for future encounters, so you don't repeatedly step on those sharp things over and over again. So learning and memory tend to go together. But the hippocampus is chock full of BDNF receptors, and it is one of the regions of the brain that is self-regenerating. And so we do have stem cells, neural stem cells, that sort of feed into the hippocampus. There have been studies, treatment, for example, of soldiers with post-traumatic stress disorder, and they go through, these cognitive and psychiatric, rehabilitation programs, and functional MRI and PET scans show that the volume and function of that region of the brain has, returned to something closer to baseline. So we were always told, right, Tim, that the brain, you're born with a certain number of brain cells, and what you got is what you got, and you just lose them throughout life. But the reality is that you can regenerate parts of your brain, but you have to be able to tap into that BDNF. And you can't do that when the pieces of the puzzle are being ignored, whether that's sleep deprivation, so insufficient sleep. You can't do that without giving the building blocks for your biology, which is food, right? You can't do that if you live in the stress lane all of the time, because cortisol, the stress hormone, blocks those BDNF receptors, because you can't grow and defend yourself at the same time. Those are two diametrically opposed systems within the autonomic nervous system. And movement, of course, is a very powerful tool for stimulating BDNF.
Absolutely. I give butyrate as a standalone supplement to athletes who've been concussed or have a history of concussions. In conjunction with other things, it's not a monotherapy, like the movement, rehab, all that stuff. Red light therapy is extremely important. One thing I wanted to touch on or ask you about and see if you use it with your patients is low-dose naltrexone.
I get a fair number of requests to prescribe it, and I'm happy to do that. I think it's very safe. I can't really think of anyone who's ever said I've had side effects from, 4.5 milligrams or so of naltrexone. That being said, I've never been wowed by LDN. Of course, it's all over the blogosphere, and those who live in these forums and chat groups and things like that. For every disease, it's sort of the magic elixir.
Right.
And there is some scientific basis. There is some peer-reviewed literature supporting its use. It's not totally out of left field or anything like that, but I just can't say that I've ever been truly, wowed by any outcomes using it. So I let my patients have it if they really want it, but I offer my opinion that, this is certainly, if you're saying multiple sclerosis is bad enough that you need disease modifying therapy, it would be inappropriate for me as a neurologist to tell my patients that this would be equivalent to something that's gone through the rigors of phase 1, 2, 3, and phase 4, even clinical trials and so forth.
Right. So I know you're huge on lifestyle and environmental health and how they're much more powerful than genetic determinism. So, we're kind of taught your genetics are your genetics, or, I'll get someone who says, oh yeah, my cancer is genetic. And when I ask them if their parents, grandparents, great grandparents had it, no, no, no. So how could it be genetic? So can you just touch on the concept of genetics loads the gun, but the environment pulls the trigger?
Well, I think that the vast majority of the time that is certainly the case. And even diseases where we know that genetics plays a major role, for example, if you mentioned Huntington's disease early on, that is due to a critical number of what are called triple repeats, where the nucleic acids that make up the DNA information, there's 4 basic nucleic acids, but there's what's called a triple repeat, and I want to say I think it's cytosine guanidine adenosine. I think it's a CGA triple repeat. But the bottom line is we all have these triple repeats. It's just these 3 letters going over and over and over again. But if you have a critical number, and I believe it's above 39, then the likelihood of developing Huntington's is essentially 100%. But my point is that you're born with those triple repeats, right? You're born with them. And many people with Huntington's may not develop Huntington's till later in life. So why is it that it takes, 40, 50, 60 years for that triple repeat burden to express itself as this clinical disease? Even if the disease may be starting sooner, sort of in the brain, there are changes, before a person ever starts knowing that there are symptoms. Regardless, there are other factors that are playing a role, ultimately sort of exacerbating or turning on the expression of those triple repeats. Not everybody who carries an ApoE4 gene gets Alzheimer's disease, and so on and so on. So even with these fairly hardwired situations, there's still, why is it that someone with a superoxide dismutase 1 mutation eventually gets ALS, but it doesn't mean that they have ALS when they're 30 years old, right? It can happen, but if we can understand what is that lag with genetic expression and what is influencing that lag, I think ultimately we'll discover that it's lifestyle and environmental factors.
Yeah, absolutely. And one thing that you mentioned before is that, or off camera, we need to stop looking at the major diseases like Parkinson's, MS, Alzheimer's, as having a single cause, because everyone wants to know what's the one thing, what's causing it, when in reality, it's a multitude of variables. And, patient X, it might be more X, Y, and Z. And in patient B, it may be more ABC, correct?
Yeah. Yeah, so that gets into our second and third pillar. After identify, we want to do investigate. And that begins with a different type of medical history we call a functional medicine timeline, which is really the story of your life. How did you get here and what is keeping you on that trajectory? So we take about an hour or so and have people tell us their story. They get a little prompting, a little nurturing to kind of tease out some specific details. But, it's amazing the things that you learn about people and help them to understand, why did this happen? But if you can understand why did this happen, it really takes you to not only an deeper understanding, but an insight-oriented, motivational kind of experience where you're like, okay, this also means there are things that I can do about it, right? This motivates me more to want to change some of the things where I can change so that I don't have to be on the trajectory that I've been on. So we do go through that functional medicine timeline, and that is then when these fancy functional medicine tests come into play. So we look at things like ApoE status, methylation factors, inflammatory drivers, antioxidants, toxins, whether it's heavy metals, biotoxins, trace minerals. We look at glycemic control. We look at lipid chemistry. So we have this proprietary panel of labs we call our brain tune-up panel. We draw from 2 or 3 different lab companies and synthesize the data together to present to our patients this laboratory picture of how did this happen from a cellular level, right?
Right.
And that's where it comes in. And then the third pillar is integrate, meaning, okay, it's like a 500-piece, jigsaw puzzle. You can get all the pieces, you can get all the information, you dump the puzzle on the table, but the puzzle doesn't make itself, right?
Right.
So how do you put those puzzle pieces together? And that's so important because a lot of our patients are overwhelmed with information. They just don't know how to implement it.
Right. I think that's really neat that you use multiple testing modalities and sort of cross-reference them to see what's going on, what's expressing, what's happening real time at the cellular level, and how this can be implemented into something the patient will be compliant with. Because the best therapy is the one the patient will actually do, right?
Right. That's right. So we're very, I've always had some form of coaching, energy medicine. We've got to get people through those stages of change. They're probably not going to even do functional medicine with us if they're in the stage of pre-contemplation, where it's not even in their world and they don't think there's a difference between, a Coca-Cola and a Snickers bar or a grass-fed sirloin steak. But once at least they get to the point where they do understand the difference, they are open to making changes. And that's really the key to functional medicine. This problem's not going to be solved with a handful of supplements. You actually have to be open and vulnerable and not and feel like you've got a whole team of people who are watching your back, who understand that you're a human being, that Rome wasn't built in a day, and we're going to really key in on understanding you as an individual, work with you, nurture you, and support you through goals that, to draw on the classic acronym, are specific, measurable, achievable, realistic, and time-based, or SMART goals, right? So it isn't a one-off visit. It isn't a two-off visit with us. You work with my team over the course of a year to create that solid foundation, just like you build a house, right? But then you have to go live in it. So guess what? Functional medicine is the rest of your life.
Right. I get that question all the time. How long do I need to take a multi-mineral? How long do I need to take omega-3s? When did you brush your teeth? Is what I asked this morning. Are you going to stop brushing your teeth? No. So I think they kind of get the point then, but I've noticed over the past 8-9 years that it's definitely gotten harder to get patients to be compliant if they're not. We can't help them feel better pretty quickly. Have you seen that as well?
I absolutely agree. Folks, we as human beings need a little bit of immediate reward. We tend to make decisions to change based on pain points, right? Because if you're a teenager who thinks it's cool to smoke cigarettes, it doesn't occur to you that 30, 40, 50 years later you might get lung cancer. You don't really care about that. So the realistic thing is, a lot of people who come to me, there's a lifestyle that has been going on for quite a while, and now their brain is starting to break down, and whether it's Alzheimer's or Parkinson's, and they're at that, guess I better do something about this point. But you still have to work with people and recognize they're individuals, and they have to be prepared to do these things for the rest of their lives.
Have you used red light therapy or a combination of red and near-infrared light, especially transcranially, for any patients?
We have a near-infrared sauna, and I've had several patients decide they like that and will buy it for their home. I think one of the things that's really super important in that discussion is, there are 24 hours in the day. Hopefully about 7 or 8 of those hours you're asleep. Some of that time is spent eating, and should be done mindfully, of course, and not shoveling the food down. Or I had a patient who existed on smoothies only because he thought food was such an, the time to eat was so inefficient that he blended all his food and drank all of his food. So, and you want to enjoy your life, right? So there's so many gadgets out there, and I'm not in any way suggesting these gadgets don't have therapeutic value, but you also have to sort of have that big picture and say, what am I realistically going to be able to accomplish in the course of a day? Or I'm going to use this 3 days a week, and for how long? And do I enjoy it, right? If you
Right.
just hate doing it, that's not good either. So we do like the near infrared sauna because it kind of hits, you can get in there, you can do a little sweating, you can do some breath work, you got the near infrared light, it's very peaceful. It's kind of a hit many nails on the head. If you want to put a helmet on, that's more power to you. But please remember that these are sort of adjunctive tools to the foundations that need to be in place.
Yeah, if you're wearing a helmet and you're going to the drive-through twice a day or even once a day, you're sleeping 6 or 5 hours a night, you're not getting sunlight, you're not exercising, the helmet's going to have marginal, if any, benefit. And so yeah, I couldn't agree more. Let's see, we have covered quite a bit here. I know you said you have included or are including in your practice some regenerative medicine techniques. Can you touch on those?
Yes. So I might have gotten sidetracked a moment ago when you talked about sort of quick return on investment, as it were,
Yeah.
give people a sense of accomplishment. And there are two aspects of regenerative medicine that we focus on in particular. One of them is hormone optimization, bioidentical hormones. And I would say of all the things that we do in our practice, besides say sort of a gut reboot where we kind of focus on an elimination diet and just really do some foundational gut healing, a lot of folks very, very quickly improve on that sort of thing. But hormones make a huge difference, particularly, of course, for women who will eventually go through menopause, or if they haven't gone through biological menopause, there's a surgeon only too happy to take out their uterus and ovaries and then tell them, oh, well, you don't need those hormones anymore. You're done having babies. And besides, they cause cancer and all this stuff, which is a bunch of nonsense. And of course, more and more of the peer-reviewed literature is now swinging back toward these hormones are critical for multiple organ systems, really your whole body. There's not a tissue in your body that isn't positively impacted by these hormones. And of course, I'm interested in brain health and the influence of estradiol, progesterone, and testosterone on brain health. But it's very clear now, increasingly clear, that women who are postmenopausal should be started on hormones as early as possible and then remain on them for the rest of their life. But I've seen people just make a 180-degree turn within a few weeks on hormone optimization. And business is business. We are business people in addition to healthcare providers. I'll tell you what, it's one of the best things for my business, because no sooner do we treat the woman, and a few months later she's dragging her husband in to get hormones as well. I mean, and they love it. They absolutely love it. So that is just an awesome service that we provide to our patients.
Absolutely.
We do some stem cell work as well, and I'd be happy to talk about that.
Yeah. So are there specific stem cells that can have more of a target or target the central nervous system, the brain and spinal cord?
So very important to understand that there are a lot of people out there who are, I'll be very frank and candid, who are either legally or illegally offering various forms of stem cells. And the FDA has made it very clear in their regulations that most of that goes on is completely illegal and potentially even dangerous. There are few actual indications FDA approved indications for stem cells. Now, the FDA has certain guidelines that, if you will, allow for FDA compliance. That does not mean that the stem cells are approved through large-scale clinical trials, but where we can be in compliance with FDA regulations. Some of that has to be that it has to be your own cells. So anything that's umbilical, that's uterine or whatever, placental, all of that completely illegal. Someone else's cells, some other animal cells. I've heard people getting shark stem cells, just awful stuff. That should never happen. So your own cells, we call that autologous rather than allogeneic, right?
Mhm.
They have to be non-manipulated, meaning that we have stem cells that live in our fat tissue. Now, it's important to understand the type of stem cells we're talking about because they're different type of stem cells. And most people think, if I use the word stem cells, that we're talking about cells that go into your body and they replace the cells that are missing. So you have Parkinson's disease, and you've lost a bunch of nerve cells in your brain that lead to that disease, dopamine producing cells, et cetera, and that somehow we're going to give you stem cells. It's going to go in there and your Parkinson's is going to disappear because you regrew your brain. That is not, now that is future looking. There are what are called induced pluripotent stem cells. There's been work in embryonic stem cells. However, that is not what we're talking about, right? So what we're talking about primarily are called mesenchymal stem cells or mesenchymal stem cells. Sorry, I lost my voice. But also sometimes called medicinal signaling cells, right? And these cells live in tissues like bone marrow and fat. They are involved with healing damaged tissue. So they're involved in inflammation and injury, right? That is what they do. So if you cut yourself, over the next day or so, you may notice some redness around the edge of the cut. That's actually an inflammatory response that's protecting you from getting a deep tissue infection from that cut. And some stem cells will come out and they will participate in the healing process by releasing growth factors and things like that, and activating genetic code that turns on cells to become new skin cells, right?
Right.
The same thing can happen in your brain, so that we have to use autologous, we have to use homologous, meaning that the role of these cells is the same as they would normally play within your body, okay? We cannot manipulate these cells in any way unless they are under the umbrella of what's called Institutional Review Board clinical trial, approved clinical trial, FDA sanctioned. That's perfectly fine if it is, but if it's not IRB approved for that purpose, you can't say, well, we have IRB approval for our product for COVID lungs, and we're going to give it to you for Parkinson's disease. Wrong, that's illegal, okay? So autologous, homologous, non-manipulated are extremely important here. And that is why the use of fat-derived cells is also in violation of the FDA regulations, even though people do it. But hey, people sell drugs on the street too and don't always get caught. Because not that these couldn't be good cells. Fat tissue is a great source of MSCs, but in the eyes of the FDA, you have to manipulate fat tissue to get those MSCs out, and that is in violation of FDA regulation. The last key is they cannot be used systemically. So it would be illegal or in violation of FDA regulations for me to give you stem cells intravenously, unless it's a clinical trial. That's perfectly fine. Has to be FDA sanctioned, IRB approved, et cetera. And by the way, if it's a clinical trial, do not pay for it. If you're being charged for a clinical trial, that's an illegal clinical trial, and you have the wool being pulled over your eyes. So what we do here is we extract typically about 60 cc's of bone marrow, because that is allowed. We use a device that has a letter of approval from the FDA that says that this device and the system can be used for not only extracting and concentrating bone marrow, but specifically separating out the mesenchymal stem cells from the rest of the bone marrow cells. This system is what is called a closed system, meaning it's never exposed to your fingers, my fingers as the doctor. It's never exposed to the air, if you will, meaning it minimizes the risk of infection. We can, from about 60 cc's, we typically get about 4.5 cc's of stem cells, and those can be introduced intrathecally, meaning directly into the spinal fluid where they can access the brain tissue. And the peer-reviewed literature tells us that cerebrospinal fluid is a biologically active fluid, meaning it's not just there to cushion your brain and spinal cord, but it actually has direct biological activity on these MSCs to induce them into expressing what are called neural elements. So here the environment is influential, right? As always in functional medicine, the environment tells the cell what to do. And it says become, the type of cell that will help heal injured brain tissue and reduce inflammation. Now, we can't say that this is a proven treatment for ALS, Parkinson's, Alzheimer's, et cetera, MS. But if we understand that these diseases have an inflammatory component, they have a component that is referred to as apoptosis or programmed cell death, and we understand the science that these cells are anti-apoptotic, anti-inflammatory, and help in the repair of injured tissue, it stands to reason that there may be benefit in using these types of cells. But like everything else we talked about, you can't go through the drive-through and get stem cells and expect that if you can just eat McDonald's and get stem cells and it'll be okay.
Right.
We have to address the causes of inflammation.
Absolutely. One thing I know that we talked about on Messenger probably 6 months to a year ago was about the vagus nerve. And I know you've seen probably more than me, information and knowledge surrounding the importance of the vagus nerve, increase exponentially over the past 10 years. Now, I know this kind of goes from medical to more biohacking and optimization, but can you talk about vagus nerve health and ways to stimulate it both allopathically and from a functional medicine perspective?
The vagus nerve is the 10th cranial nerve. It gets its name from the Latin, which means wanderer. And there are two vagus nerves, right? Because you have the right and left side of the brain, or right and left side of the brain stem. Primarily, the one on the right is sending information down to the internal organs, including your heart, your lungs, and your digestive tract. The one on the left is sending information from these organs up toward the brain. But the vagus nerve is sort of the nerve that connects everything together. That's first of all. And it has connections to that limbic system that we referred to earlier. So when we talk about breath work, meditation, chanting, all of these things, use of tools like HeartMath from the HeartMath company, the Inner Balance or the M-Wave, even the PONS device, all of these things are ways to access and stimulate the vagus nerve, upregulating the activity of our parasympathetic nervous system, or rest, digest, and reproduce. Because the reality is that too often we get caught in that fight or flight. Things are imbalanced, and when we're in fight or flight and never in repair mode, never in healing mode, then the body is not going to get better, not going to heal itself. So there are many paths to that mountaintop. Some of them are more conscious and direct, if you will, but nevertheless, the vagus nerve remains an important concept and physical structure and accessing our ability to heal our bodies very directly, not just spiritually, absolutely, but physically through hormones and other, through our stem cells and so forth, they will not work unless we're able to get into that parasympathetic healing mode. In conventional medicine, one classic use of the utilization of the vagus nerve is in epilepsy. So I have a lot of patients who have an implanted device called the vagus nerve stimulator. Sometimes this is referred to as VNS therapy. And this has been around for 26 years in commercial use for 26 years. It was FDA approved in 1997. And so the VNS device is adjunctive therapy, typically for what is called focal onset or partial onset seizures. But it's interesting that stimulating the left vagus nerve, again, sending signals toward the brain, not away from the brain, has all kinds of positive effects, ultimately reducing the frequency of a person's seizures.
That's awesome. That's truly remarkable. I think you mentioned a few people. I don't know if you treated these people or you just knew about them, but they had a vagus nerve stimulator implanted, and it was healing. I have to choose my words carefully. Conditions it wasn't even intending to heal. Is that correct?
Yeah, well, I would say that interestingly, based on, again, peer-reviewed literature and large-scale clinical trial, the company that originally made the VNS device, which is called Cyberonics, they're now called LivaNova, but Cyberonics did a study back in about 2002 or so, 2002, 2003, on treatment-resistant depression. And not surprisingly, the evidence suggested that a VNS device was at least reasonably effective for those who had failed, Prozac and other similar types of therapies. And even think about electroconvulsive therapy for treatment-resistant depression, given the choice, I'd far rather have a VNS device than have my brain, slammed against a brick wall with ECT. Not to say that ECT hasn't saved some lives. I'm sure it has. But I think we would all agree that the impact of VNS is far more gentle than ECT. So it definitely improves well-being.
Absolutely. So I asked you before to name one or two items that you know now, but you wish you'd known 10 years ago. And I think one of those items was that drug companies are not the evil enemy to be avoided, but they are only one part of a multifactorial system. And the second thing was doctors don't fix their patients' problems, patients fix themselves. They become the CEOs of their own health, correct?
I absolutely agree with both. Sometimes we say that, the operative word in functional medicine is function. There are definitely situations where functional medicine is 100% curative. In most ways, I think we'd all agree that, type 2 diabetes, the insulin resistant diabetes, that's not a life sentence, right? You can turn that around. You can make changes in diet and lifestyle, correct hormone imbalances, remove toxins, and essentially cure someone. Now, could they become, if you will, diabetic again if they fell off the wagon? Absolutely. But diet and lifestyle can have a profound effect on insulin resistance. Are we going to have the exact same outcomes when it comes to Parkinson's, Alzheimer's, ALS? Probably not, but we sure can change the trajectory, right? We can create a situation for someone who can function again, who might in certain circumstances be able to go back to work for a little while longer, have more time to interact with their family, their friends, do the things that are most important to them when they wake up in the morning with that strong sense of purpose. So to leave those tools on the table and ignore them completely and say, well, you have Alzheimer's, there's nothing you can do about it. Start planning the end of your life. Take the pill. It doesn't do very much. Good luck with that. Just zaps people of all hope. And it's just an unreasonable approach to what can be done. But no question about it, it is so critical to change one's mindset and be open to these possibilities, because to be successful in functional medicine, you do have to be your own CEO.
Absolutely. So well said. Thank you so much for your time. We're going to put your links to your website, your social media channels and accounts. We're going to put all of those in the show notes. Is there anything else you want to leave us with, Dr. Sharlin?
Well, anybody who would love to work with me or work with my team, functionalmedicine.doctor is the website, and my book is available on that website as well as on Amazon. Please check out our YouTube channel, Facebook, and so forth. We're trying to provide folks with as much valuable information as we possibly can, and would love to meet you.
Well, thanks so much for the work that you're doing. I'm sure some people will reach out, if it's not for themselves, for a loved one or family member, because it's really, folks, let me just tell you, it's extremely difficult, next to impossible, to find a neurologist like Dr. Sharlin, who's so well trained in so many different modalities, and he's not tied to one dogmatic approach to everything's caused by this, and I'm just going to treat it with this. So feel free to reach out to Dr. Sharlin, and hopefully in the future, next year, we'll have you back on again.
Thank you so much. Appreciate
Thank you,
it,
Dr. Sharlin.